What is up, guys? So today we're going to be working on a little bit of a thoracic spine mobility technique. Now, rotation in the spine is very important, for grappling and jiu-jitsu and anything you want to do. You want to have good movement in the spine. Sometimes we may take that movement from certain areas and because we're lacking in other parts of the body. And so in this instance, we're going to focus on the thoracic spine, getting some movement, a little more movement through the thoracic spine. Now, we've all kind of seen some of these exercises where, we're doing like a thread the needle, reach through. We're getting a lot of good global rotation throughout our spine in general. But I want to try to focus more on the upper half of the spine, the thoracic spine, so kind of the area between these two hands. Now, it's not perfect. This is not going to isolate it completely because none of our movements really purely move in isolation. There's a combination of movement through multiple joints when we're rotating. But this one I feel like can help focus a little more on the upper part of the body. The way that we'll do this one is we'll actually get into a kneeling position and we're going to bring our elbow kind of to our knee here. So what I'm doing is, the position is this. I'm trying to sit my butt on my heels and I'm bringing my elbow in here, right? On this other hand, there's a variety of things we can do. We can have the hand behind our back or onto our head here, okay? So here's the position we're in. We're sitting back, elbow here. We can have our arm behind the back or right on top of our head. And what we're gonna keep this connection between our elbow and our knee. We're just gonna take the upper half and the elbow is going to flare out this. We're going to try to rotate. Now again, you can add a little bit more, but what I feel like this does, I do feel kind of more in the upper half of the spine. I'm not getting as much of that rotation through the lower back. So again, starting here, we'll do a couple in both ways. So this way, just opening up, come back down, holding about 5 seconds, doing about 5 reps. The other one, of course, take that hand, put it behind your back, and we're going to just kind of pull that elbow back, squeeze that shoulder blade, keep that shoulder down, not wanting to shrug up into our ear there. We're getting kind of through a little bit of everything, okay? Again, from this angle, I just feel like they kind of isolate certain parts of the spine more. Again, we're here. We can do the arm, let's go at the head, rotating this way. And I'm squeezing the shoulder blade as well that I'm pressing on just to keep a good activation. Rotating here, behind the back, this way. Now, this is actually a great assessment tool as well. If you're someone that's trying to see if you're limited, you can literally go to one side and record yourself and go to the other side and just see if there's a difference in your rotation. Let's do a quick test with me. We can do here, we'll go behind the head, rotate one way. So see how far that is. And then I'll look back at the film and I'll see if I'm limited. I'll go up this way. So, all right, guys, that's a great one to use to just kind of loosen up the spine. Again, you can use it in conjunction with like the reach throughs, the threading the needle this way, then going down and working on this capacity or that way as well. So you can do it that way just to get various parts of the spine, focus more on those areas. But this is a great one, very important. Rotation is something, we definitely lose over time, just like most motions, as we age. So it's important to try to keep that and keep your spine moving healthy. So that's it, guys. That's a quick rotational mobilization or movement drill that you can do before you get to training. Talk to you guys next time.